As soon as you get rid of that. There we go. So good morning. It is Senate Health and Welfare, and it is March 17th. This morning, we have Monica White with us, who is the Commissioner of Department of Aging and Independent Living with us. We're doing a confirmation hearing and going to be talking with Monica a little bit about her role, who she is. And before we do that, I think I'd like to have the committee introduce themselves. Go ahead.
Good morning. I'm Senator Ruth Hardy from the Addison District.
Cheryl Hooker from Rutland. Nice to meet you.
Jenny Lyons Chipman.
Josh Terenzini, Rutland.
And Collins, Washington.
Good morning. It's great to have you here. And so I think, why don't we begin with your just sharing with us a little bit about your background and the work that you've done. We don't have a bio as yet, so it'd be helpful just to fill in for us who you are.
Okay.
Professionally.
Great. So thank you so much for having me here. Again, for the record, Monica White, Commissioner of the Department of Disabilities, Aging, and Independent Living. I've been in this role for about a year now. It was last March 14th, I believe, that I was appointed in an interim capacity, and then on July 1st as permanent, or not permanent, but official in the official capacity as commissioner. And prior to that, I spent 6 years as Dale's Director of Operations. I will say that my time with Dale has been the most rewarding of my career to date. I can honestly say, while I've enjoyed other jobs, every other job has been a job. This one, my time with Dale has really aligned my strengths and skills with my passion for serving older Vermonters and those with disabilities. So, and before that, I had previous roles with the Agency of Human Services as Director of Healthcare Operations, Compliance and Improvement, and Financial Director. And before that, I worked for Blue Cross and Blue Shield of Vermont in various roles in quality improvement and provider contracting. I have a Bachelor of Science in Healthcare Administration from St. Joseph's College of Maine, and a Master of Business Administration from Norwich University, and I'm a 2014 graduate of the Snelling Center, Vermont Leadership Institute. So that's my quick professional bio in a nutshell. On a personal level, I'd say my biggest accomplishments are my family. My daughter Julia is a senior in high school this year, actually dual enrollment, and she'll fully enroll in Champlain in the fall, which we're very excited about. And I have two twin 14-year-old stepdaughters in 8th grade who Maris and Atia, who are just delightful young humans. And my husband Jeremy is a PhD candidate at UVM. And we live in Plainfield with 2 dogs, 1 cat, and 25 chickens. So it's kind of a zoo.
So you're used to herding cats and chickens.
Quite literally.
That's good. All right. Thank you for that. And so just share with us a little bit about your thinking about where Dale is at this point and what you think might happen to take the department forward, some of the issues that you've identified since you've been there.
Sure. So yeah, thank you for that question. So Dale has a number of extraordinary strengths as a department. First and foremost, I would say I refer to our department as Team Dale. We have about 300 staff who are incredibly dedicated, competent, talented, passionate individuals for our mission to make Vermont the best state in which to grow old or to live with a disability with dignity, respect, and independence. I think everything that we do and do well is as a result of the passionate team that we have, and I'm honored to be part of and to lead that. We consistently rank at the top of virtually all metrics on the annual DHR employee engagement survey. So a baseline, my priority is to keep that momentum, capitalize on it, and continue to be an employer of choice so that we can do the work that we need to do to meet our mission. So beyond that baseline, working to grow our leaders from within, assure that our staff are fully engaged and excelling at what they do on a daily basis. The other kind of external priorities I have for the department, really in no particular order of importance, but just generally areas of focus for me include a continued focus on healthy aging in the state. We through this committee and others, the Older Vermonters Act, which was passed a couple of years ago, was really landmark legislation. Vermont has been is one of the older states in terms of demographics, and with that comes a lot of really great strengths. And I think the Older Vermonters Act, specifically the Vermont Action Plan for Aging Well, offers a great opportunity to get all stakeholders at the same table to really synthesize and capitalize on the strengths of aging and what can we do to assure that we are the best state in the nation in which to grow old, including metrics across self-determination, safety, financial security, social connection, etc. And that work has commenced in terms of the Vermont Action Plan and Aging Well Advisory Committee, and is poised to take on some really great work on that front. So that is certainly one of my priorities for the department. Another priority for the department is stabilizing our developmental services system. We internally had quite a bit of turnover in last year due primarily to retirements, folks taking other jobs within the department. We had a couple of folks leave for private sector positions. And it's a small division, and that really created some instability. I'm very, very pleased to say that all of those positions are now filled with extraordinary candidates, including our new director who started at the end of January, and working with that new team to solidify the work internally, as well as solidifying and aligning multiple really important processes that are coming up for the system over the next, within the next few handful of years. And that includes a revision to the state system of care plan for developmental disabilities, a focus on residential options, funding under the home and community-based services, the ARPA funding, the 10% one-time enhanced funding, conflict-free case management, adherence and compliance to the federal regulations for conflict of interest in case management, and payment reform. So we have quite a bit of work ahead of us on that front with our external partners, and assuring that that all stakeholders, including persons with developmental disabilities and their families, are heard and at that table. So that is one of my major priorities. Another is you may be aware that our Division of Vocational Rehabilitation recently underwent a rebranding initiative. So just a few weeks ago, we launched a public ad campaign, and the VR is now known as Higher Ability Vermont, HIRE Ability Vermont. And with that, a push to really be more accessible and less of a stigma than the word rehabilitation, that often the connotation with that word can turn people off from receiving services if they have a disability and are looking for assistance with employment or career options. So the term vocational rehabilitation came about about 100 years ago, after World War I. So it was way overdue.
Time for change.
Very much time for a refresh, absolutely. So the excellent work of that division, moving that forward, continue with a continued and enhanced focus on transition services for youth who are exiting high school, and continuing the focus on career and educational credential attainment, not just get a job. So working closely with individuals to determine what they want their career path to be, focusing on high wage jobs, And really, it's a win-win-win for persons being served, employers, certainly in the state's economy. So really focusing on the great work of Higher Ability Vermont. I still catch myself wanting to say VR. It does take a little bit to catch up to that. So that's one priority. And then again, without having any of these in a particular order, workforce stabilization across all sectors as we come out of the pandemic. I think I'm sure that it's something that you've heard across really every sector is workers, workers, workers. So that's true really across all of our systems of care, from developmental services, long-term care facilities, home and community-based services within choices for care, and every other under this line, but focusing on what's under my area of focus within Dale. And then finally, I would say that one of my other priorities is not specifically a policy priority, but just how I want to do business is getting out to see the people that we serve. So not just operating from behind my desk in Waterbury, but getting out and meeting people that we serve where they're at, the partners that we work with that deliver the great services that they do. Really a collaborative leadership approach. And in my previous role, that was something that I prioritized was, taking a day, riding along with my staff, spending a day with one of my public guardians and adult protective service investigators, the vocational higher ability counselor, higher ability Vermont counselor, like really virtually all of our frontline staff spending a day in the life of and working with the people that we serve. And in my current role, I fully intend to do that too, being out and about in the community so that I'm seeing and hearing for myself what is going on. And now that the pandemic is all fingers and toes crossed, moving into the endemic stage, being able to do that is now is great. There was a brief period in the fall before the Delta wave picked up that I was able to start going out, and of course pause that with the variant waves. But now getting those meet and greets and out there in the community on my schedule is a priority. So those are the high level points.
Just a few things you're working on. Yeah, okay. Well, thank you for that. I appreciate the sort of the looking at everything that you're doing. And we've heard about the work. Higher ability is something that I'm very much aware of, and that you've started, and it does sound like an improvement going forward. So as you said, to take the stigma away, really terrific. So it can, and with all of the things that you're doing, and is there you've talked about the strengths of the programs and what you're trying to really reinforce. Where are your concerns? What are the, obviously there are weaknesses everywhere, but what are you identifying as needing some support either from us in terms of resources or policy? Where are the gaps?
Sure, great question. So for that, I would say in terms of our developmental services work, stabilizing that division is and the division itself, the internal division is stabilized, but stabilizing the system, I guess, in terms of all of those pieces. So pulling on the update to the system of care plan that we're working on now, and then the other three components. So that is an area that I've heard loud and clear from constituents that, or from people that we serve, that there are areas for improvement there. So that would be one of the areas of, I wouldn't call it necessarily weakness, but requiring stabilization, I think is how that I would frame that. Another a couple of areas that will be forthcoming is with as it relates to adult protective services. We were able to capitalize on some federal grant funding streams through ARPA for expanding or creation of positions called service navigators and other positions there. So really those positions, which are relatively new, are kind of helping to bridge a gap between in the system as when we investigate for abuse, reports of abuse, neglect, or exploitation of vulnerable adults. We have our investigators out there, and then oftentimes there can kind of be a gap. So what happens if somebody is not found substantiated, but there's still clearly a need for services? So how to bridge that gap, and the service navigators that we had just started through the federal opportunity through the Administration of Community Living are helping to address that. That's relatively new, and just that comes with the federal strings of not sure how long federal grant funding strings are attached. So, but at least for the next few years, but I think we're going to see some really, we already are seeing some positive outcomes as a result of that. But related to that as a gap is also part of the Older Vermonters Act was the requirement to convene a self-neglect working group, which we have done, and the group is working right now on the report that's due to the legislature, and will be coming up. So you'll be seeing that in July, I believe, is when the submission date is, and I anticipate that within that report, I'm not going to get ahead of it because it's not finalized at this point, but I anticipate that there will be some legislative items where the legislature would be helpful to address, because self-neglect from a policy perspective for older adults in particular, but certainly any vulnerable adult, presents significant challenges for us as a system with somebody because people do have the right to self-determination if they don't wish to avail themselves of services, but they're in a hoarding situation, their home is unhealthy, they're self-neglecting. That is an extraordinary challenge for us because we all care. We don't want people to be living in really horrible conditions, and so I anticipate that there'll be some requests or action points from that report from the self-neglect working group.
Thank you. And one more question, then I'm going to turn it over to Senator Harding. And actually, I'm going to turn it over to Senator Harding because I'll ask my question a little bit later. It takes us in a slightly different direction, I think.
Okay. Thank you. Thank you, Commissioner, for being here with us. One of the things, two things from your personal perspective, it sounds like you don't have a lot of experience sort of working on the front lines, that you've mostly been in administrative positions. Is that correct? Or just
for my paid jobs, yes, that's correct. I did spend about 13 years as a volunteer firefighter and EMT. Really, I would absolutely consider that front lines, and that brought me into homes and into the community in general, but into homes and serving vulnerable people at often the worst times of their lives. So I do have that experience. I also volunteered doing overnight shifts at the Good Samaritan Haven homeless shelter in Barrie for a couple of years, doing I spend the night on my little cot in the office and help out there. So from those fronts, I have those experiences in my history.
well, that's good. It just sounds like in the field right now, there's just so much stress and so much almost desperation from frontline workers who are trying to, in nursing homes and long-term care facilities and hospitals, et cetera. And also from families who are trying to care for their loved ones at home. So it sounds like you do a lot to try to get out with your own staff, but I'm wondering, how do you connect to make sure you're understanding what's going on on the front lines with people beyond your own staff?
Right, so that's part of my intent for starting now, as it's safe to do so, is to get out and have those in-person stop-ins with partners and people we serve across really all of our segments of the systems of care. So absolutely being, having those conversations, and then not just having the conversations on the phone or through my laptop, but getting in my car and driving out to all areas of the state, because that's so important. I think especially farther flung regions of the state often feel a bit disconnected from Waterbury, from Montpelier, and so getting in my car and driving to Bennington and to the Northeast Kingdom is critical for that, and making myself accessible because that's hugely important. I don't have all of the answers. I don't pretend to have all of the answers. I want to hear from those who do have suggestions about how we can make things better.
Yeah. And one of the things I hear from constituents, just sort of in general, is that when they have a family member to care for in their own home, and we heard this when we were working on the bill about Alzheimer's that I worked with your agency very closely with, but we also hear it in other realms, is that the system is really difficult to navigate for families. They're not sure who to call, and they call one person and they are told to call somebody else. And I myself actually had to enroll my mother in Choices for Care last year, and it was not easy. And so I'm wondering what your plans are, what your vision is for making that system more accessible for average Vermonters, just in general, the systems of care.
Yeah, that's a great question. I think there is a great amount of work to be done on that front, because my own parents are helping to help a friend of theirs who's having a situation where the spouse is in the hospital and not sure. So without getting into all of the details there, but it's extraordinarily complex. And I got a call from my stepfather, who was almost in tears because he was having such a hard time navigating and accessing it. So I'm acutely aware that in some cases it's not always straightforward and it's challenging. And sitting here right now, do I have the answer for what that fix is? Because there are extraordinary amounts of federal regulations that need to be followed for Medicaid, but I know that we can do better. And one of the things that I think is a strength that we have within Dale is a number of staff who in recent years have undergone greenbelt training. So the continuous improvement and really focusing on developing that skill set to take a problem and parse it out and to streamline and make process improvements. And I would say across many, I don't know, I wouldn't say most necessarily, but at least several programs, there are things where the external person on the street legitimately has trouble navigating because it is complex. And so how can we take the tools that we have and the skills that we've developed to put that into work and streamline it? Candidly, there's a lot of work. The workload has been pretty intense through COVID, so there hasn't been bandwidth for that. But prioritizing, making those improvements for the people that we serve, so it isn't navigating through A's and hitting tripwires all over, because it's complex at a really difficult time. It's a very emotional time, right? When someone that you love or yourself are going through challenges, when somebody's experiencing a dementia or something like that, you're already at a heightened emotional state, and so then having kind of needless red tape to navigate, like we can do better on that front for sure. And prioritizing that isn't, I didn't mention it as kind of one of my broader policy priorities, but approaching issues from a continuous improvement lens is absolutely on my radar and is important.
Good. And one final question is, we've had lots of conversations in this committee over the last few weeks about sort of broader healthcare reform, health finance reform, passed S285, which creates a system for hopefully moving forward with a different payment system for our hospitals. And one of our conversations was how do we bring long-term care into this, home and community-based care? And so I'm wondering, as we move forward with, hopefully move forward with that type of reform, how do you see your department fitting into that with the work that DEVA's doing, the Green Mountain Care's doing, Green Mountain Care Board, to make sure that we're bringing along the really important parts of our healthcare system that are sort of under your purview?
Yeah, so I will say that in the past few years, in particular, the past couple of years, particularly through the pandemic, really taking an increased focus at the agency of human services level to be an agency of one. And I know that has been lingo that has been out there forever. But I've seen a very much an increase in collaboration between. It's not a DMH problem. It's not a Dale problem. It's an us problem. It's that we need to figure it out together. And as it pertains to healthcare reform and that sort of thing, that is very much an agency approach. So we do have the office, I forget the title, but Ina Backus's area of healthcare reform within the agency. But really all of the projects that Ina and Wendy Trapton are working on, looking at with DEVA, Dale is at that table. And it's, it's not even me having to argue to get us at that table, because it's like a standing invitation so that we are there, and the recognition of home and community-based services as an integral part of our health system is there within AHS. And so making sure that our appropriate, experts in choices for care, developmental services, et cetera, are participating in that within internal discussions and also external discussions as appropriate.
Thank you. That was a question I was going to ask. Other questions from committee folks? Go ahead, Senator.
You mentioned the number of staff that you have. Could you reiterate that? I'm sorry.
Sure. It's roughly 300 positions and staff. There's variable with full-time equivalents and such, but I use 300 as a round.
And can you just give us an idea of how they're distributed?
Sure. So we have our commissioner's office, which includes legal, our business office, operations, and of course myself and Deputy Commissioner Macon Tierney Ward. And then we have our 5 divisions. So we have Division of Disabilities, Developmental Disability Services Division, which has our Office of Public Guardian and DDSD program staff there, and of course the numbers and now trying to do the math in my head between who's where, and then we have our Division of Vocational Rehabilitation, as it's known in statute, Higher Ability Vermont, which is our biggest division, which has presence in all 12 districts across the state, but headquartered in Waterbury. Division of Licensing and Protection, which oversees adult protective services and survey and certification, also throughout the state, and Division for Blind and Visually Impaired, which is our smallest division, I think maybe 10 staff, with folks across the state, and then Adult Services Division, which oversees Choices for Care and our Older Vermonters programs, and also throughout the state. So I think I hit them all.
Talk to me about Adult Day and how your shop interacts with that, and what we can do maybe to increase that, throughout the state. I mean, during the pandemic, we saw adult daycare centers closing, and what are people able to do, or what are we able to do to improve that situation?
Yes, so we do interact closely with adult day centers throughout the state, primarily through our Adult Services Division. Yes, you're right, there have been closures. I believe it was 3 adult day centers closed over the course of the pandemic. And right now, we are actually working with the adult day, and I think there's actually meetings today, now that I think of it, to focus on how to support them in being able to increase enrollment at this point now that the pandemic is waning. What do they need? So to find out from the adult days, what do they need to assure that they're able to get more people back in the door, and recognizing that staffing is an issue. Is there, as it is everywhere, is there an opportunity to perhaps leverage volunteers for some of the non-clinical work within the adult day settings? So things like activities and things that don't require the clinical. Our area agencies on aging have really been phenomenal about leveraging volunteers throughout that network. They've been phenomenal in many ways, but that's just one. And whether the adult day can capitalize on that kind of opportunity to help bolster the staff with volunteers to be able to have greater capacity for persons coming in, to be able to kind of get back to census numbers where they were pre-pandemic. So that's one area of focus there.
Sure. Any other questions? Senator Terenzini, Senator Cummings?
Which fire department did you serve on?
I did, not anymore. Plainfield Fire and Rescue.
Which one?
Plainfield?
Oh, Plainfield. Oh, right here.
Yeah, we're just over yonder.
I was on Rutland Towns for 9 years, so
Oh, yeah, nice.
anytime someone talks about it, perks me up a lot.
Yeah, it was definitely, it was a fabulous experience, and only got done because candidly, I went through a divorce and left Plainfield. I'm back now, but
Sure.
I left at that point. But it was some of the most phenomenal, memories, and how it is when you
There's nothing like it.
nothing like it.
It's a team.
So absolutely.
Well, we greatly appreciate your time and hearing all the things that you're working on in the department. There's a lot there, and some of our most vulnerable Vermonters that you're in care of, and there continues to be a concern for us, and we will have a bill in here. I know the House is sending us a bill, I think it's 270, yeah, it's H 270, but it is on disability rights, so we may well have members of your organization, certainly you. I hope you've been looking at that bill.
Yes, age 720, and I think I'll be here next Thursday morning, or I'll be on the box next
All
Thursday
right,
morning.
we'd be happy to have you do that. And if you could send your short bio, and then I think Senator Hooker's question about the divisions within your department, that would also be helpful for us to see.
Sure,
So I
yeah.
think folks need that. And I know it's on the web, but it's
Yeah, I will
probably
be happy
easier
to
for you
send
to-
that along
yeah,
when
that would be
I get back to the office. So.
and
Can I just ask, I'm just curious, we talk so much about workforce and the need. Are you finding that you have applicants for positions that are open?
For Dale positions, it varies. We have some clinical positions that we've had a really difficult time filling. Some of our RN positions. I think as the pandemic wanes, my hope is that the kind of the bubble, I don't know what the term is, but of where travel staff were really the incredible amounts. As that goes down, that perhaps at least that will stabilize. I think that's probably been our largest challenge. But other positions intermittently, we've had some difficulty fulfilling, and others we've had lots of applicants. So it's kind of all over the board.
thank you. This is great.
Okay, well, great. I very much appreciate your time, and I will follow up with this couple of pieces on the
Yeah.
back.
Yes, and in terms of process, we'll probably have a conversation tomorrow about your confirmation, and I wouldn't be too concerned. And we look forward to having you reported on the floor of the Senate.
Okay,
Thank
great.
you.
Well, thank you very much. Have a wonderful day.
And thanks for being here. This is great to have you in person.
It really has been,
Yeah.
as I was saying before, it's like, it's been a couple of years since I've been in this building, and it's just,
Well,
it's good to be
it's a
back.
new Totally.
All right, well, thank you very much.
Thank you. Take care.
Thanks, you too.
Yes. Bye.
All right. We're good. So we can have a follow-up conversation. Possibly we'll have some time tomorrow after we go through the bill with Jen. But I think we can go off YouTube now.